Throughout the COVID-19 pandemic, hospitals and health systems have been forging new partnerships with stakeholders to ensure ongoing care for their patients, healthcare workers, and communities. To highlight these efforts, AHA has launched a new series of resources called Joining Hands for Greater Impact. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hederle, Executive Speechwriter for AHA. Over the next few months, we'll be sharing stories from across the country of how these hospital-community partnerships have addressed urgent community needs throughout the pandemic. The first podcast in this series will focus on how a hospital and a local faith-based organization came together to address health equity concerns and vaccinate their shared community. This podcast is moderated by AHA's Priya Bathija, Vice President of Strategic Initiatives. She's joined by John Zervos, Executive Director of Henry Ford Health System's Global Health Initiative and lead of mobile vaccinations, and Mirvat Kadu, Vice Chair of the Board of Trustees at the Islamic Center of America. They'll discuss how Henry Ford and the Islamic Center came together for a series of vaccination events. This podcast was funded in part by a cooperative agreement with the Centers for Disease Control and Prevention. The contents of this resource do not necessarily represent the policy of CDC or HHS and should not be considered an endorsement by the federal government. Priya, over to you.
Thanks, Tom, and thank you, John and Mirvat, for joining me today. I'm so happy to be talking with both of you, and I'm looking forward to hearing you share your insights and experiences on the vaccination events that you've been holding in Michigan. So maybe let's start with some background on your organizations and the communities that you serve. Mirvat, can you tell us a little bit more about the Islamic Center of America and some of the health inequities you've been seeing in the Muslim community throughout COVID?
Sure. The Islamic Center of America is located in Dearborn, Michigan. It was established originally in 1963 in Detroit, and we moved to our new location, which made us the largest mosque in North America in 2005. So during the pandemic, we were basically one of the only mosques that stayed open throughout the whole process. We never closed for one day, knowing that the community needed a place to come for comfort. So we've been serving the community ever since, and we're here.
And John, can you tell us a little bit about Henry Ford and the broad variety of vaccination events and clinics that you're holding for your community?
Yeah, first off, Priya, thanks so much for having me. It's a pleasure to be joining Mirvat on your podcast. And Henry Ford Health System is a large nonprofit health system in southeastern Michigan with a very strong commitment to health equity. And my department at Henry Ford is the Global Health Initiative. And our mission is mostly internationally focused. So we do a lot of education and research programs to impact the lives of vulnerable, marginalized populations all over the world. And really when COVID hit, our team looked to refocus our energy locally to help address what we considered one of the largest global health pandemics of the past 100 years. And our group pivoted and worked really with our local health department here and communities here, starting off with testing. Our team stood up the rapid testing clinic here in the city of Detroit. We then went into the nursing homes and other congregate settings to do testing. My team also led both the Moderna and Johnson & Johnson clinical trials at Henry Ford as well. And now with partners such as Mirvat, we are really actively engaged in the rollout to make sure that we get shots in as many arms as possible.
Can you give us some examples, some of the types of events you've had to vaccinate multiple people in one place or time? I know we've talked offline about mobile vaccination clinics, and if you could share about those, that'd be great.
Yeah, so as a system, overall, Henry Ford Health System's done about 200,000 doses, and a lot of those have been through our mass vaccination clinics. However, we've also early on decided that mobile outreach efforts are urgently needed. And about 20% actually of the work of the doses that we administer at Henry Ford have been given through mobile outreach. And our first effort was really at a church in Detroit called Second Ebenezer, where we vaccinated 500 individuals at a church here. And it was a partnership with the city of Detroit. What we saw in that was that these were individuals that weren't going to get vaccinated unless it was at a location that was convenient to them, it was a place they trusted, and it reduced a lot of the barriers for people to be able to get the vaccine. And when we saw the success of that, I immediately turned to my team and I said, this is just one faith-based organization. Who are we missing? And so we looked at the data that was shown at Henry Ford and also at the state, and we saw other big gaps. The Middle Eastern vaccine uptake rate was extremely low. Hispanic population uptake was really low. And we decided early on that we're going to go big on our mobile vaccination program. And to date, we've done about 16 of these different sites. Some of them, such as the mosque, are weekly events because of the high demand. And what we've said to all of these partners is if you continue to have the demand at your sites, and we'll continue to come out there and bring vaccine to the places where people want to go to get them.
Both of you have been working together for a while now on this great mass vaccination event at the Islamic Center of America. Can you tell us how your partnership started?
Sure. I was contacted by Tony Al-Jalad, who was a representative at Henry Ford, and he talked to me about, what do you think? Would you be able to do vaccinations at the mosque? And I was already talking to other places trying to get it to the mosque, and I was very fortunate that it worked out with Tony. And we met at the mosque and we did a walkthrough and did logistics of what we needed to get done. We were very excited and blessed that we're bringing it to the community because we wanted to be part of the solution. So we were very, very excited.
So Mervat, can I just build on that a little bit? Why was it so important to have a vaccination event focused on the Muslim community?
Because the Muslim community are eager to be with family. It's a cultural thing. So we have lots of gatherings. And as much as we tell them you need to social distance or you can't go see your parents or your relatives, it's hard for them to understand that matter. And that's why our numbers are so high in Dearborn, because they're trying to be safe at the same time, not miss out on family gatherings or events or happiness or even sad times. I mean, our mosque has been through many, many funerals, and it's very, very close to our hearts that we get a solution because we need this to stop. Partnering up with Henry Ford was a blessing, and Henry Ford made it very easy for us. And they had their location. It was the center of Dearborn. So we were able to reach out to many other communities within our area.
And Mervat, the same sentiment on my end too. You make it easy for us. I consider your site really a no-brainer because we're bringing the vaccine, but Mervat's team is doing the scheduling. They have volunteers on site. They're making sure people get in and out and hear about it. And even most importantly, we did a lot of work in advance of coming out to the site. So just bringing the vaccine alone really isn't enough. And we at Henry Ford stood up a vaccine confidence committee really early in the pandemic, actually. And what that was focused on is trying to improve uptake amongst both our hesitant employees and also hesitant community populations. And one of the strategies that was undertaken was working with faith-based leaders, such as the Imam of ICA, and doing town halls that really where people could attend, ask their personal questions related to the vaccine. And then literally we would come, in a few weeks or even the next week and deliver the vaccine right at that place that these individuals trusted.
We even made sure that we had all our imams vaccinated prior to. So if they're going to speak about getting the vaccine, they should be the first to take it. Our imams and our staff, most of our staff, probably only just a few didn't, but are all vaccinated. So that made it even more confidence in our center to even, talk about it to our community.
And that's really great. And I think the point that both of you are making about how it has so much work that needs to take place in advance of actually having the event is something that we've heard consistently in all of the conversations that we've been having. So what did it take to actually get it off the ground? Who was at the table? What cultural and religious factors did you have to take into consideration? And how did you actually address the vaccine hesitancy in the community? And Mervat, I know you talked some about, having the people at the Islamic Center be the first to get the vaccine, and that was very important. But were there other pieces of that were helpful as you launched this?
We had our imams talk at our Friday prayers or any events that we had. We made sure that imams were spreading the word and talking about the vaccine so they can make the community more comfortable of educating. So that's the major thing, is really education, educating our community about the vaccine and how safe it would be.
And really on our side, it was just listening to Mervat and the other leaders at the mosque about what would work for them. So being flexible on the day of the week that we would come, being flexible on even the type of dose administered, which we don't do really as a health system. All the vaccines are great vaccines, but if we can reach a wider population using a specific vaccine, we're going to explore that through this model of partnership. And I think, just really listening and being able to build on the trusted partnership week after week. The other big thing I think is just the commitment to each other that we're going to be in this together as long as there's demand at the site. And then even beyond that, what are we going to do together after the pandemic to ensure that we can actually build off this partnership as well?
Yeah, and I've read that there may be some hesitancy in the Muslim community around getting the vaccine during Ramadan, which is coming up quickly in April. Mervat or John, can you talk about that concern and whether it exists and how you planned around it as you took this on?
Sure, I could start off. The hesitancy is there. But we made sure that our imams talked about it and spoke about it. And I can do a little bit of quote that our Imam Kazaruni had stated, quote unquote, is the current information available on the makeup formulas of the current vaccines don't contain any food-related substances, nor do they have any vitamin issues. They're okay to be taken, and such vaccines do not invalidate your fast. So it's very, very important. A lot of Muslims think that if I take a shot, my fast is invalidated. And so we've been telling the people. So we did have challenges of trying to get the doses, the first and second before Ramadan. And then we had challenges of people taking the first dose, but the second one is going to be in Ramadan. So it's just educating our community and just letting them know it's okay. And it's been doing well. We've been booking weeks in advance, and John can attest to that it seems like Ramadan is not going to have a bump in our plans, but there are going to be hesitancy during Ramadan.
And it's not easy to pull off mobile vaccination programs. They're long days. You pick up the vaccine early in the morning, and then you work long hours, and then you bring any unused doses back to pharmacy. But this past Monday, we did about 600 people at the mosque, and that's really our goal moving forward. We think that's a good number, and we'll get through a good amount of people if we're able to continue that. I'm also really open to thinking about creative things we can do about maybe even providing some early morning or later at night hours as well for some people that, even though the imam says it's okay, might still be hesitant, and maybe we can even do it outside of fasting hours. So if we hear that from the partner, we're open to being creative on that as well.
That's really awesome to hear. And you've done a couple rounds of these. You've been working together for a while now. So what lessons have you learned just generally about mass vaccination events and specifically mass vaccination events for the Muslim community?
I can start off with just what we've learned about mass vaccination events. I think the biggest thing is there is a huge demand for these across the board. So based on, really what we've done at the mosque, and a lot of people have really heard about that, they've seen that, and we get a lot of requests for similar events at different organizations. So even though we're doing this 6 days a week, really there is a significant need for many organizations to be doing these across the board because, as you know, there's a lot of places in Michigan to get the vaccine right now, but there's long lines, people lining up and signing up within hours. Yet I think sometimes that masks a lot of the hesitant populations who are not getting the vaccine. And really, we feel strongly that the way to get to those populations is through these efforts where we actually get to organizations such as ICA that people trust.
At the Islamic Center, where we make sure that the comfort is available, that the community is trusting the mosque. That's why they come to the mosque. And there be those littlest gestures that we do that many vaccination sites don't. We don't have these long waiting lines, people outside in the rain. We do appointment settings. We have our chairs 6 feet apart when they come in. We comfort them when they're walking in to take the vaccine. After the vaccine, we give them water, coffee, just as they wait. It's a very caring and nurturing process that we're doing. And we're getting a huge appreciation, not only from the Muslim community, even outside of the Muslim community. You have people like sending us notes and gratitude for how they were treated and they were treated with respect and comfort. So that's one of my main focuses when I was working. And Henry Ford is great. I mean, they have a great team. Now, remember, we're one team doing this. We have a bunch of volunteers with the Henry Ford system and put us together. And we honestly did create something different than the outside.
Yeah, and that caring mentality also has been extended to our team. So, for example, Mervat and the ICA provide us an amazing lunch each day of Middle Eastern food that we go, and my team just loves it. And so we really are appreciative that, the commitment to comfort is not just for the patient, but also they made it so easy and welcoming for our team to be on site.
That is so great to hear. And I will tell you, I did not get water or food or anything when I showed up to get my vaccine, but I was just happy to have the vaccine, right? So based on your experiences, and maybe John, I can start with you for this question, but what are the key elements that you found are needed to have a successful relationship between a hospital and a faith-based organization?
Yeah, so we found that a lot needs to go into really that first conversation on what each partner's roles and responsibilities are, and really laying those out there. The other thing that's been really important is kind of just a site visit where we go out to all of our sites, spend time with the leadership, meet them in person, actually do a walkthrough, set that up, and then continued communication. So Mervat and I now text each other on a regular basis. This is a new partnership that I have now with Mervat that we didn't have before, and really just making sure that that dialogue stays open and that you refresh those roles and responsibilities as things change and as new issues develop as well.
It's a really nice dynamic that we have with Henry Ford, and honestly, we're very appreciative, and the community is too.
So what comes next for your partnership? Do you see ways to partner in the future outside of vaccination clinics for the pandemic?
Yeah, and this is really something that I think is a critical question across the board for COVID. So we've created new partnerships, not only with organizations, but now also with individuals. So, for example, a lot of these individuals that have come to the mosque have not been Henry Ford patients prior to coming to the mosque. We've created a lot of new MRNs. And so what are we doing to link these individuals to primary care after COVID? And what are we doing with the mosque to do different types of educational and health events at the mosque after COVID? Could we do health screenings on heart disease? Could we do cancer screenings? What different events could we do? And we're actively in the process of talking about what that looks like for after COVID.
And also that I found that one of our challenges was within the Muslim community is the lack of literature. We're hoping that we can be able to build that gap, to bring more literature and educate it within the Arabic language for the elderly, for people who don't speak or read English. So hopefully that will come soon.
Well, it's exciting to hear that all that you're learning throughout the pandemic will help make healthcare better for your community after the pandemic. And I guess I'll just end with one last question. And John, this is related to Henry Ford and the work that you're leading there. But what is your next focus when it comes to equity and vaccine distribution in the Detroit area?
So we have to start with the data. We have to see what populations we're missing, what zip codes we're missing. And as I said before, we're getting really daily requests from new community partners to come out and do what we've done at the mosque. And we will continue this work till the end of the pandemic. We're doing about 20% of the vaccines from Henry Ford Health System currently, and we will continue doing that. There's also a few populations that we're particularly focused on as well, thinking about strategies for. So one is nursing home staff in the city of Detroit. So only about 30% are vaccinated at this point. So we're thinking about creative ways we can get out and do vaccination for the staff here in the city. We've also seen low rates in Southwest Detroit, which is primarily a Hispanic underdocumented population as well. We're thinking about creative things we can do with that population. And then another one of concern actually is students. So we're looking at really the 16 and 17-year-olds as individuals that are actually spreading COVID at very alarming rates in Southeast Michigan. We're thinking about bringing vaccine directly to public schools to be able to protect against future surges.
Well, thank you for sharing that, John. And thank you, John and Mervat, both of you, for joining me today and sharing this important work. It really is an excellent example of how hospitals and faith-based organizations can partner for vaccine distribution and also in the future after the pandemic. For those that are listening, to access more resources on COVID-19 vaccine distribution, please visit aha.org/vaccine confidence. Thank you all for listening and have a great day.